So today we will discuss the risk factors for kidney diseases. As we all know, diabetes is number one cause of kidney disease. Diabetes worldwide, if you see, the nearly 50% of kidney diseases are from the diabetes or blood sugar. Obviously, the blood sugar is the number one risk factor for kidney disease. If you have blood sugar, so always you have a chance of kidney disease. But again, remember that doesn't mean that if you have a blood sugar, that doesn't mean that you will have a kidney disease. Nearly one third of patients of diabetes develop some form of kidney disease. Again, some form means it may be a very early stage of kidney disease, and fraction of these patients of kidney disease develop goes to the advanced kidney disease. So, if you are a diabetic, you should be cautious, but you should not panic. But that if you are diabetic, it doesn't mean that you will develop a kidney disease, but obviously you will be at higher risk. You need a higher screening for kidney disease. The next risk factor will be the blood pressure. Again, although the blood pressure is not the as frequent cause of kidney disease as diabetes, but again, if you are a hypertensive or if you have a elevated blood pressure, certainly you will have a risk factor for developing kidney disease. So even if you are detected, especially if you are a young patient and had a hypertension, then you should check your kidney functions with some certain test, or you must visit you ask your doctor if you have any kidney problem or not, because young hypertensive may have that kidney problems. Again, that doesn't mean that if you are aged you should not check. Even if you are a aged person and a hypertensive, you should have a kidney check. Other risk factors are like some rheumatological disorders like SLE, rheumatoid arthritis. They have a risk of developing these kidney diseases in future. So if you have some rheumatological disorders, you may have a certain kind of screening for kidney disease. The patients of the persons who are taking regularly painkillers for any problem, they are also having a risk factor for developing kidney disease in future. There are certain diseases that runs in family. So if you have a family history of kidney disease, that your father, mother, or grandfather, or some paternal uncle had some kidney problem, you may develop kidney problem in future. So if you have a certain history of kidney disease in your family, you may go for a screening of kidney disease. Other things, that the patient or person who had some kind of kidney problems in childhood may have a risk factor of developing frank kidney failure in future or in adulthood. So if you had a history of any kidney problem in your childhood, you may better choose to screen your kidney function. Thank you.